Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Myofascial Pain, Raynaud's Disease, and Sweating with 40 plus years of Herbal Mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, Herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the traditional Chinese medicine community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Synergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. And for our new attendees joining us today, allow me to familiarize you with our webinar room. Please set your chat from hosts and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day, late afternoon, for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Oh, hi guys. Happy New Year. This is the first time of 2025. We got a new topics and a very interesting lot of cases for you to share with you. And it's very important. I believe all these topics we're going to talk about in this new year is something that will always happen in your office, in my office, every day. And with lots of people with the same complaints every day. So, so tiring. Anyway, this is today we're going to talk about the myofascial pain, Raynaud's disease, and sweating. Sounds like ordinary, no big deal. Actually, it's very, all those are commonly same problems every day. Huh? So, in the beginning, there's something about the logic we're going to talk about. It's important that you can tell the patient's condition, constitutional condition from the patient's appearance. That's the most important step before you make up your mind of what to how to treat them. And look at their appearance, then you can choose your approach. and corresponding prescriptions. When we're talking about right way. In other words, design your treatment approach by their body types. Is he or she chubby and strong, or weak, or anemic, or normal, or something? And also, you can tell their condition by using the blood pressure and heartbeat rate, like we talked about before. If the heartbeat rate is fast and the blood pressure is high, that means solid heat, or deficiency, or yang deficiency, or something. In that case, after studying this condition, then you'll be able to know, even before examining the patient's condition, you should have something already in your mind that what to do or what not to do for this patient sitting in front of you. And definitely with the pulse diagnosis is so important, right? So heartbeat rate. So for example, there's a young lady sitting in front of you, the heart blood pressure is 90/60 and heartbeat rate 65, then you can definitely tell this lady is in a yang deficiency status. And no matter what, no matter what, the no matter what the patient's demand, do not use too much cold medicine. Do not use too much blood mover, like I always like to use. Do not use too much freezing, anti-inflammatory medicine. No matter what, you should do something to tonify the body, like 人参养荣汤, or even 十全大补 for this type of patient. No matter what, that's very, very important. And if the blood pressure is 65/100, heartbeat rate is 95, I'm sure this patient is either man or woman will be complaining, "Oh, doctor, I'm so tired. I'm so feeling fatigued. Please help me with all those, with the Chinese herbs. I'm so tired of taking all those stuff." And again, no matter what, you do not give 十全大补 or 黄芪建中汤. To tonify his body. Even his major complaint is so tired, doctor, I'm so freezing cold. Don't mind that. According to the blood pressure, this guy is in a so-called real fire, volcano fire. So you should try something like a cold medicine, blood movers, somehow to clear the head, lowering the blood pressure, enhance the circulation, and the energy will come back. That's very, very important. Yeah, something like this. If the guy is normal, like this, well, you're free to use anything. As if the guy is chubby, then you might be some dampness. You should use something to clear the dampness to help him to get better energy. If his major complaint is energy, but most of the time they're complaining about the pain here, everywhere. And for a skinny guy with a little bit anemic, and don't use too much cold or blood movers. A lot of a pain in our system, pain medicine, are blood movers. Like a 生痛竹鱼汤, not for weak people, but this little weak, this is chubby, this is normal. So when people with this body type, you're free to use anything. And for this body type, you're gonna use something to clear the dampness. And for weak people, well, don't use too much, and this normal, fine. But even she's skinny, looks like so weak, so vulnerable, so pale. But if the blood pressure is high for skinny, weak people, that means could be the kidney type of blood pressure. You gotta be very, very careful. Good. And by looking at their body type, you can tell what kind of a condition this man or this woman are in. So you should be able to make up your mind about using the herbs. Qi deficiency looks so tired. Yeah? And in this case, 十全大补汤 should come into your mind. Yang deficiency, cold and weak, freezing the legs and hands, and the body is cold, and the qi is weak. Then you can tell it's yang deficiency. You might use my kidney yang tonifying combo. Kidney yang combo. Neutral. Good. Oh, phlegm, dampness. That's easy. Before you make any kind of a diagnosis, by looking at their body type, you have something on your condition. In deficiency, the blood pressure is, oh no, blood pressure is very low. The heartbeat rate is fast and high and too much. But the blood pressure could be 90 over 60, and heartbeat rate can be 20, 120. Oh, that's in deficiency. Or, I'm sorry, this one. Or hyperthyroidism. So you got to be careful. You should already have something in your mind that, oh, we should not, no matter what the treatment, the major complaint is something we do not use for this kind of a body type. That's very, very important. And stagnation, qi stagnation, the blood pressure is normal, but heartbeat rate may be slow, and everything, by looking at their face, so dark, so brownish, so withered color is, you can tell. Damp heat means the pulse is jumpy. I always tell them, hey, sorry, your body is like a volcano. Oh, everything's flame. Well, meaning there's a lot of inflammation. So you can use anything. Blood stasis, the face is dark, and the tongue, the bottom of the tongue is dark. A lot of dark pigmentations on the face, on the forehead, on the hand, on the toe, fingernails. They have some dark straight lines there. And the bottom of the tongue is full of a green vein. It's not green, it's supposed to be blue. Some blue veins, then you know the stagnation. Then you know what to use, no matter what. Huh? This doesn't matter. This got nothing to do with the body type. So this is what you should put your mind to before doing any kind of a examination, blood pressure, a pulse diagnosis or whatever. You get a good idea of what to use, no matter what the major complaints may be. But today we're going to talk about the myofascial. This pain is on the surface of the muscle and the tendons, outside the bone, and the people will complain a lot of pain. No matter what, we have our way. Don't worry. This condition, I'm sure I got almost 80% of my patients every day having this kind of conditions. Fascia is the thin sheath of the connective tissues that can be built by vitamin C that surrounds and hosts all the organ, blood vessel, everything, like some soft tissues. The tissues does not more provide internal structures and nerves that makes it almost as sensitive as the skin, very sensitive. Anything, small things can trigger the pain. It tightens up when stressed, by emotional stress or physical stress, it tightens up. That's the key point. What does it mean tightens up? The pores become tight. So how do you know the pulse is tight? 寸关尺. Usually, normal, the arteries should be soft and thick and soft. The major ingredients of the pulse diagnosis feelings is soft. But this pulse is like a tight. How do you know this is tight? Like you're pulling a guitar string from both ends, then the wire becomes so tight. That's the word, tight. When you press down, you feel the rebound very strong. You cannot push it down because there's a lot of force from both ends to the opposite direction, making the string very tight. So the pulse in there usually is that inch area, tight and thin. Oh, this happens a lot on the left chi. So when you take the pulse, this is ordinary, even. Okay, let me get on this. Sometimes the pulse is like this, soft and normal and thick. It's not like what Dr. Chang said, it's thin and tight. No, but, no, there's a but. There could be another one alongside with the normal pulse. So when you take the pulse, you take it in the beginning, normally you take the pulse vertically down to feel the shape and jump. But afterwards, you should take the pulse from the side like this. Horizontally, take the pulse, and you might find something there situated here, alongside with the normal pulse. You say, the arteries are just arteries. So how come there's another thing along with it? That's impossible. There's nothing else in there. Well, there is always this two pulse, thick normal pulse and thin pulse alongside together at the same time. I cannot explain them in the physical condition, but it does happens all the time. So even the pulse is normal and vary, but be careful. Try to touch the pulse horizontally with your fingertips. You might find another one here. That's the tightness. That's what the tightness means. So the conclusion is the especially left chi, it is possible you have two pulses in there, one thick and soft, one thin and tight. You may say wiry. So together with this one, and this is the things we're talking about today. And you might want to tell or say it's some kind of a neuralgia, the bone spur or disc pulse, something like that. They're all the same. So, it tightens up. So that's why I invented my spasm combo to release it. It works like the Western doctor used the muscle relaxant to loosen up all the tight muscles. But my spasm works fast in few hours. I checked the medicine book, the muscle relaxant, it might take 2 weeks to start kick in. But my spasm combo works in a few hours. So the pulse will be long, thin, wiry, and tight. Do you know what tight is? Just pull a rubber band, put strength on both ends, and the wire, a rubber band, a thread, or something will become tight. That's easy, right? So this is my invention. 芍药甘草汤, not 芍药汤, with not this one, not 芍药汤. 芍药汤 is for small intestine. So the small intestine pulse will be like this, a arterial pulse on the left swing. And 芍药汤 is for digestion, for the small intestine. But This 芍药甘草汤 is totally different. It is for spasm. Like ladies with their severe pain in their period, when the period comes, or the muscle spasm, or people when they work too hard, or work out too hard, or play sports too hard, they might get a muscle spasm. This one works. But mostly this is focusing on the abdomen area, the muscle, the belly muscle, that spasms. Okay, and also for the lower limbs too. And 川链子圆弧. Oh, sorry, I made a mistake. This one. No. Okay, it's 川链子 and 圆弧. This together, this is called 金灵子散. 金灵子 means golden bell, something like that, because the flower is like a golden bell. So this 川链子圆弧 is a muscle relaxant. Actually, it's some kind of a tube, like a duct relaxant. Like what? Like the gallbladder, the bile duct. Hey, low in battery. What's going on? So this is for like tighten tubes inside the human body, like a bronchial, like a bile duct, like the fallopian tube, and all kinds of tubes inside the human body. This one can loosen it, including the muscle. So I put them all together. I call it spasm combo. You should have it already made in your office, in your clinic, and help you to get better treating result. Just look, acupuncture works like the spasm too. When you get tight and pain, needle it, and everything will lose up in a few seconds. And so can this combination. So it's very great invention. You should try it. Huh?